30 minutes pag hindi maalon. Pag maalon, 45 minutes to 1 hour.
In Daram, Samar, the lack of a road system within the island is the foremost hurdle in delivering health services. Marianne is one of 12 rural health midwives in this municipality of 58 barangays. They need to walk or ride boats in order to perform their duties. Lack of cooperation and coordination among the local government and Daram's health workforce led to difficulties in implementing their health programs.
Dahil nga island municipality kami, tapos wala kaming roads. Yung pag-gather pa lang, most of the time may bagyo, habagat. Nahirapan kami lalo na sa mga midwives. Lahat iniikot at saka yung island namin elongated. Iikot ka talaga ng malayo.
In 2010, the municipality made an evaluation of the infant deaths in Daram. The rising number of cases alarmed Mayor Astorga and the Rural Health Unit.
Noong umabot ng 12 ang infant deaths namin, alarmed talaga ako, kaya umupo ako sa infant mortality audit. Pinuntahan talaga namin yung mga catchment, barangays, station. Nalaman namin na ang malalayong lugar dapat ma-reach out ng mga health personnel.
At the suggestion of ZFF, Daram crafted a performance management system or PMS for its medical personnel. The PMS aims to ensure the standard quality of performance among health service providers. A performance evaluation system created by the Rural Health Unit, the PMS is customized according to the specific roles and functions of each health personnel.
Ang performance management system is actually a monitoring tool na every performance is graded. Tapos, clear ang mga targets nila na every month talagang nakikita kung ano ang mga accomplishments nila. Nang makahanap na kami ng doktor, natugunan niya ang PMS. So, doon sa PMS, weekly may monitoring. Tapos monthly, nagdi-discuss sila, nagmi-meet sila, at discuss nila yung mga accomplishments nila.
The PMS urged health personnel to work better, thus improving Daram's health indicators. Facility-based deliveries have increased rapidly from only 4.5% in 2009 to 66% in the first half of this year. Indicators for the tuberculosis and immunization program have also become better. PMS help unify and transform the health personnel into a team.
Yung PMS, lahat kasi ng programs ng doon, lahat ng nagawa namin na hindi noon na-emphasize, parang doon nakita, ganito pala yung midwife, kadami yung trabaho, kadami yung ginagawa. Lahat na role na naklaro, lahat na programa, lahat pala ng ginagawa namin may impact.
In San Fernando, Romblon, politics played a role in the unfavorable health outcomes of the municipality. After the 2010 barangay elections, 70% of the barangay health workforce were new and inexperienced. This is because of the practice of newly elected barangay officials to appoint their supporters as health workers, even without experience.
Primero, nung umupo ako, na feel ko na hindi talaga nagkakaisa ang mga staff sa Municipal Health Office. Nagpatawag ako ng meeting at ang mga kapitan ay kinumbinsi ko rin na talagang dapat natututukan din nila itong isyong ito. So ang ginawa, ang barangay health workers, hindi na nga nila pinaltan. Nung hindi na, so training na ang mga barangay health workers.
Additional BHWs were also hired to reduce their number of assigned households. Their annual monetary incentives were also raised to 2,000 pesos. The improved situation of the BHWs facilitated the increase of facility-based deliveries in San Fernando from 45% in 2009 to a high 95% in 2012. Even the tuberculosis cure rate is now at 67% from 37% 3 years ago. In June of this year, Mayor Rios, together with Mayor Festo Galang of Kahidyokan and Mayor Manzala of Magdiwang, signed a memorandum of agreement to sustain the health gains and protect the rights of BHWs. The arbitrary removal of BHWs was apparently common practice in the whole of Sibuyan Island. The Memorandum of Agreement states that BHWs cannot be terminated without justifiable reason, as their service in the community is done under the principle of voluntarism. It also reinforced the Barangay Health Workers Benefits and Incentives Act. A BHW Manual of Procedures was created as guide in implementing the terms of the agreement.
Kaya napaka-importante ang barangay health workers. Ang mga barangay health workers ang aming extension sa barangay. Araw-araw tinitingnan nila talaga kung sino may sakit, sino ang buntis, sino may problema. Kaya napaka-importante. Without them, I think the system will collapse.
As a dentist, first-time Mayor Jocelyn Lelis made health her priority when she was a board member of Sorsogon, but her programs were limited to medical and dental missions. The problems of the fifth-class fishing municipality of Prieto, Diaz overwhelmed her when she assumed the mayoralty post in 2010.
Napakahirap kung paano umpisahan. Nung nakita ko yung budget, kapos sa pondo, kulang sa human resources, at yung mga empleyado, hindi ko alam kung love nila ako.
Most of the elected councilors and barangay leaders were not members of her political party.
Hanggang sa pagdating ng Zwilig Family Foundation, nabigyang buhay yung health bilang pangunahin namin dun sa agenda ng aming master plan.
But first, she needed to gather the correct information on the different health indicators in Prieto, Diaz.
Maray na aga, ay pwede mag-interview sa imo tabi, Catherine.
With the health data collected by the barangay health workers, Mayor Lelis became aware of the needs of all 23 barangays. She drafted a master plan called the Integrated Health Education Livelihood Public Service Excellence and identified 4 areas to focus on to achieve sustainable development. These are food security, education, livelihood, and healthcare.
Pagpipresent po ng inyong lingkod ng plans, strategies sa kanila, wala po akong tinitingnan na kung sa akin ka o hindi ka sa akin. Nakabase sa datos po lahat. Doon po sila nakaisip din siguro na kaya naming magawa. Kailangan naming magkaisa para maabot namin yung mithiin ng Prieto Diaz, at andun yung suporta nila.
Her plans and prioritization programs soon won the support of all the local leaders.
Una po, medyo nagkaroon ako ng konting hesitant. Then, nung i-present niya sa amin ang kanyang programa doon sa under iHealth Prieto Diaz, napakalaki po ng improvement. Unang-una, dati-dati maraming mother and neonatal death. Anong inakap namin, nag-zero na po kami sa maternal death at sa neonatal death.
Health scorecards are prominently displayed in every barangay. It is a constant reminder for local leaders that the presence of any poor health indicator would have adverse effects on their municipality's progress.
Yung accurate information has helped us in drafting responsive policies and plans as we continuously improve our town's health status. And since lahat po kami aware sa lagay ng aming munisipyo, andun na po yung pagkakaisa namin na maayos at makamit namin yung tunay na diwa ng inclusive growth.
Hello? Halata, suratong ko ah. Anong pangaran? Saan pong barangay ka mo? Del Carmen. So baka mangaki ka na po papakwata ka pong ambulansya dyan.
6 hours away from Prieto Diaz, the municipal doctor in a town in Camarines Sur is just a call or text away.
Hali sa Del Carmen, barangay Del Carmen.
In Minalabac, pregnant women have a 24-hour access to medical advice. They can text or call their town's doctor about pregnancy-related questions. In case of emergencies, they can quickly go to the nearest birthing facility. This is part of Minalabac's Project Mama, or Maternal Assistance Monitoring Activity, a program that aims to make maternal health care efficient, cost-effective, and sustainable in this fourth-class municipality.
Napansin ko na hindi masyado specific yung mga problems na dapat naming address. We better concentrate on maternal health, infant mortality, ganyan, nutrition, pero dapat specific, hindi yung sabog na programa. So nakinig ako sa kanila and then pinag-aralan ko rin and I discovered na talagang salat, kulang kami.
He dispatched barangay health teams, armed with spot maps, to conduct house-to-house pregnancy inventory. Once identified, the women were given pregnancy information data cards to accomplish.
And we were able to gather a very comprehensive data on maternal health. May kopya kami dyan. Mayor's office may kopya. May kopya yung mga midwives natin. At may kopya rin yung mga health workers, yung mga BNS namin, yung mga community health leaders namin para pinagtutulungan namin to.
With this information at hand, potential health emergencies are easily identified and prevented. 2 new birthing clinics were also built with the help from the Zwilig Family Foundation.
Babae, lalaki. Anong pangarang
From his limited knowledge, Mayor Basmayor is now well acquainted with every pregnancy case in Minalabac. He asks the town's midwives to report to him directly. He even goes to the birthing clinics to visit the women who just gave birth. This dedication made Minalabac residents take notice and actively participate in the program.
Ngayon, napakarami na ng mga nanganganak sa mga facility. Talagang na-track down namin bawat bahay, bawat tao na pregnant, talagang na-track down namin. Wala na ngayon kami namatay na nanay. Yung ginagawa namin para rin sa kanilang mga pamilya. Naging ugali na namin na talagang pagtulungan namin to. Part ng pagpapalakad ng bayan namin, ng mga barangays namin, naitanim ko na sa utak ng mga tao na ito kailangan natin.
The Zwilig Family Foundation believes that local leadership is the key to changing health systems and innovating programs. With 3 years left to attain our Millennium Development Goals, the health change model is a big step in achieving our country's desired health outcomes.
Lahat kailangan mag-involve from barangay officials at saka yung pinaka-the poorest of the poor.
Yung health-seeking behavior ng tao, dati hindi nila hinahanap yan eh. Okay lang sa kanya kung mamatay sa bahay. Ngayon, hinahanap na nila na ito pala right. Health is right.
So the Zwilig is the bow, and we are the arrow, and God is the archer.
An empowered leader in an empowered community. This is the Cohort 2 experience.